start CME program on prevention of cervical cancer. In last few months, Gynae Onco Society has conducted 10 CME program on ovarian cancer. Today is the starting of the cervical cancer, and we all know that is the prevention is better than cure, and prevention is better than the best treatment of any disease. So we'll start with the prevention of cervical cancer. Today's topic is researches done on Bangladesh for prevention of cervical cancer. Today we have two chairs. Our first chair is our beloved Professor T.A. Chowdhury. He is the professor of Gynae Onco in the Bangladesh. He is one of the senior most professor in Bangladesh. Our second chair is Professor Kohinoor Begum. He is the professor of Gynae. Please go to Kohinoor Madam. Sir is not here now. Please go to Kohinoor Madam slide. Kohinoor Madam slide, please. Kohinoor Madam is the professor of Ops and Gynae. She was the president of OGSB, and she's the president of Pediatric and Adolescent Gynae Society of Bangladesh. She was the past president of OGSB. At present, she is the vice president of DCPS. And next slide, please. Professor Kohinoor Madam is the vice president of the BCPS, vice president of the Endometriosis and Adenomyosis Society of Bangladesh, and she is the vice president of Bangladesh Perinatal Society. She was past secretary general of Bangladesh Menopausal Society. She's a very favorite teacher of all of us. She has many publications. She has presented many lectures in many national and international seminars, and she has guided many researches in gynecology. Today with us, we have Professor Sabera Khatun. She is the Secretary General of Gynae Onco Society of Bangladesh. Professor Sabera Khatun is the founder chairman of Gynae Onco Department, Bangabandhu Sheikh Mujib Medical University. She is the founder Secretary General of Gynae Onco Society of Bangladesh. She was the founder chairman of Bangladesh Society of Colposcopy and Cervical Pathology. She is the chairman of Gynecological Cancer Clinical Trial Group in Bangladesh. She is the member of Oncology Committee Suffolk. She introduced postgraduate degree in Gynae Oncology in Bangladesh. She is related with many research work in Gynae Oncology during her chairmanship tenure in Bangabandhu Sheikh Mujib Medical University. She has many publications. She is the author of 2 books. She has presented many scientific papers in national and international seminars. Today, there will be 3 presentations. First presentation will be on researches on risk factor for prevention of cervical cancer. It will be presented by Dr. Lutfa Begum Lipi. She is the assistant professor of Gynae Ops in Dhaka Medical College. Recently, she has completed her fellowship in Gynae Oncology. She is colposcopy trained, and she is a trainer of colposcopy. She has advanced training in Gynae Oncology in USA and Germany. And she is the organizing secretary of BSCCP. Our next speaker is Dr. Samima Chowdhury. She is an assistant professor of Gynae Oncology in National Institute of Cancer Hospital, Research and Cancer Hospital. She is also colposcopy trained and trainer in colposcopy. She has few publications and research on HPV vaccination. She will present researches about prevention of cervical cancer by HPV vaccine. Our third presenter is Professor Fawzia Hossain, FRCOG. She is the professor of Gynae Oncology in Bangabandhu Sheikh Mujib Medical University. She is the vice president of Bangladesh Society of Colposcopy and Cervical Pathology. She is the International Affairs Secretary of OGSB. She is the chairperson of Gender-Based Violence Committee. She is the member secretary of Gynae Oncology Subcommittee in OGSB. She is the honorary secretary of IRC-RCOG. and she has contributed many Gynae books. She has been invited speaker in many national and international conferences. She is the editorial member of National Menopausal Society and Fertility Preservation Society. She has received many awards, and she has many publications also. Today we have national and international panelists. Our first panelist is Dr. Namkha Darji. Namkha Darji has been graduated from University of Colombo, Sri Lanka, and Namkha Darji has obtained his postgraduate degree, MS Gynae and Obs from Bangladesh. He has few publications also, and he is very enthusiastic. He is very popular to Bangladesh. Our next panelist is Dr. Bhagyalaxmi Nayak. She is the professor of Gynae Oncology in Acharya Harihar Postgraduate Institute of Khesar, Cuttack, Odisha. She is the co-chair of Oncology Committee Suffolk. She was the past chair of the Oncology Committee of Hoque. She is the vice president of AODI in India. She is the joint secretary of Popular Agoy, and she is the assistant editor of Indian Journal of Gynae Oncology. Professor Bhagyalaxmi Nayak has received many awards. She has presented many scientific papers in country and outside country, and she is very, very popular to Bangladesh.
Thank you.
So first of all, I would like to request Professor Sabera Khatun, Madam, to give welcome address to the CME program. Professor Sabera Khatun, Madam, please.
Professor Mozammel Hoque, Appa, please introduce
Professor Mozammel Hoque, sir. Next, please. Professor Mozammel Hoque, sir. He is the professor of biochemistry in Bangabandhu Sheikh Mujib Medical University. He is the author of many books. His special interest in his clinical biochemistry, biomedical science, and research methodology and statistics. He's a very popular teacher, and he's related with the many research work and has been worked as a guide, and she is quite extraordinarily experienced in biostatistics in Bangladesh. I'm sorry, sir. And next, please. So now I would like to request Sabera Madam to give the welcome address for our today's program.
Thank you, Dr. Suraya Begum. Honorable Chairperson of today's first international CME on researches in Bangladesh on prevention of cervical cancer, Professor Chowdhury sir, co-chairperson Professor Begum, and other dignitaries. Assalamu alaikum. GOSB has started monthly CME since 11th April 2021. Since then, 10 CME on ovarian cancer has been performed, and our last CME on ovarian cancer was in 15th June 2022. Today, this is our first international CME on prevention of cervical cancer. There will be series of CMEs on different aspects of cervical cancer. All of us know that 99.9% of cervical cancer is preventable. It is the most common gynecological and second common woman cancer in Bangladesh. Its incidence is 19 per lakh in Bangladesh. According to WHO's, we have to reduce this incidence up to 4 per lakh when we can say that the cervical cancer has been eliminated. So, to achieve this target, we have to do some groundwork to know about some basic factors information about cervical cancer in Bangladesh. So, with this aim, we have started our series of CMEs to find out the baseline information about cervical cancer in Bangladesh. Now, first of all, I would like to give my heartful welcome to our chairperson, Professor T. Chowdhury sir, and co-chairperson, Professor Begum, for their kind consent to grace the occasion as the chairperson. Then I would like to welcome our very learned and dignified panelist, Professor Mozammel Hoque. I think everybody of Bangladesh and abroad know about his contribution in the field of researches in Bangladesh. Second panelist is Dr. Bhagyalaxmi Nayak of India. Take my respectful welcome to this CME. And third panelist is Dr. Namkha Darji. He is very well known to Bangladesh. I am welcoming you in this CME with great affection and respect. Lastly, I would like to welcome our three learned speakers, Dr. Lutfa Begum, Dr. Chowdhury Samima, Sultana, and Professor Fawzia Hossain. Thank you all for your kind cooperation. Thank you all.
Thank you, madam, for your nice deliberation. Now, I would like to request Professor Begum, madam, to say something regarding to this program.
Assalamu alaikum. Thank you very much for inviting me to attend this conference on prevention of cervical cancer. Today we'll be discussing on the various researches that we have done in our part of the country. Cancer research is a research that includes the identification of the cause, development of a strategy for prevention, diagnosis, and treatment and cure. There are various fields of cancer research. For example, biological research, genomic research, causes, treatment, and these clinical trials, etc. As a low resource country, we are not in a position to do this biological or researches because it takes huge money. But for our country and low resource setting, we can do the clinical trials. And this is also helpful because it can identify the data on various causes, presentations, treatment modalities, which is appropriate for our country, and the treatment results. So we can formulate the strategies, national strategy to prevention and treatment. So it is very good news that this GOSB is doing this research for a long time. Professor Sabera, when she was in BSMMU, she started this research, especially on vaccination and its effect on these young girls. And there is many other research, like Professor Mozammel and so many persons, they are very much involved in this research. So I think this session will be a very good one, and we must know, but we will know the part of the research that we have done here and also the results. Thank you very much. Thank the international faculties for attending our conference. Thank you.
Thank you very much for your nice speech, madam. We will always feel happy and comfortable when you are with us, madam. Madam, thank you, madam. Now I would like to request our first speaker, Assistant Professor Lutfa Begum Lipi, to present her presentation. Dr. Lutfa Begum Lipi.
Is my slide visible?
Yes, your slides are visible.
Thank you. Honorable chairpersons, respected my teachers, and distinguished guests from home and abroad, and my senior and junior colleagues, Assalamu alaikum. Welcome you all in the first international CME on researches in Bangladesh about prevention of cervical cancer, organized by Gynaecological Oncology Society of Bangladesh. I am Dr. Lutfa Begum DP, Assistant Professor working in a gynecological unit of Dhaka Medical College Hospital, going to present my topic on researches done in Bangladesh on risk factors of cervical carcinoma. Globally, cervical cancer continues to be one of the most
Slide
common
change.
cancers.
Slide change করা দেখা যাচ্ছে না।
Can you make a slideshow also?
ম্যাডাম এখন চেঞ্জ হচ্ছে না?
No, no, no.
No.
এখন কি চেঞ্জ হচ্ছে ম্যাডাম?
না না চেঞ্জ হচ্ছে না।
So make it slideshow first, and then on the slide you can click.
Yes, I am in the slideshow.
Okay, okay. But here it is not showing. Now slide is changing.
Okay, it's okay. Dr.
Now it's
Lutfa.
changing?
Yes,
Yes.
yes.
Full
Now
screen
changing?
করো। Changing. Full screen. Slide full screen করো।
Yes, madam, it is in now full screen.
It's okay.
আচ্ছা, ঠিক
Okay,
আছে।
continue, please.
Okay. I
Previous
think
slide.
slide show করলে ম্যাডাম চেঞ্জ হচ্ছে না স্লাইড।
Is it changing now, Lutfa, doctor?
Changing? Is it changing now?
Yes.
Yes.
Please
Changing?
continue. Lutfa, please
Okay,
continue.
thank you. Sorry for the interruption. Globally, cervical cancer continues to be the one of the most common cancers among females, being the fourth most common cancer after breast, colorectal, and lung cancer, and it amounts almost 12% of all female cancer. Globocon 2020 estimated that worldwide there were approximately.
Slide change হচ্ছে না। পরের স্লাইডে দাও।
Madam, I'm the same slide পড়ছি ম্যাডাম।
Okay.
Globocon 2020 estimated that worldwide there were approximately 6 lakh new cases of cervical cancer with 342,000 deaths annually. Among them, 85% of the new cases and 90% of the deaths occur in low and middle income countries. In
Dr.
Bangladesh,
Dr. Lutfa, you are going wrong. You are talking over a slide, and that slide must be shown on the screen.
Yes.
in Bangladesh, it is one of the second leading malignancies in terms of both incidence and death. Cervical cancer caused by human papillomavirus, a sexually transmitted virus. But epidemiological studies conducted past 30 years have consistently indicated that there are some risk factors that increase the risk of cervical cancer. Is my slide is now changing?
Okay.
Okay, so what is the risk factor? What is risk factor? A risk factor is anything that increases anyone's chance of getting a disease such as cancer. Different cancers have different risk factors. It helps to focus on those that can be changed or avoided, like smoking or human papillomavirus infection, rather than those cannot be changed, such as age or family history. Still, it is important to know about the risk factors that cannot be changed, because those who have these factors to get regular screening tests to find the cancer early. So it is established that there are some risk factors that is related to development of cervical cancer. These are started having sex before the age of 16 or within a year of starting period, young age at full-term pregnancy, have multiple sexual partners, multiparity, take birth control pills, especially for longer than 5 years, smoking, have a weakened immune system, have sexually transmitted diseases, and exposure to diethylstilbestrol in utero. So in the next few minutes, I am going to highlight some researches that done in Bangladesh on these risk factors. This article assesses on assessment of socio-demographic profile, risk and delay factors of cancer cervix in Bangladesh. It is published in Journal of Clinical Trials and Regulatory Affairs in 2017. It is a cross-sectional study conducted in Dhaka Medical College Hospital on newly diagnosed 200 cases. And this study shows that mean age of the patients was 47.9 years, 41% in below the poverty line, 56.5% are illiterate. Age at marriage between 10 to 15 years was 65%. 57.5% of these women aged between 16 to 20 years have their first childbirth, and 33.5% before the age of 15. 56% uses oral contraceptive pill as a contraceptive method. it was stated that the long-term use of oral contraceptive pill could be a cofactor that increased the risk of cervical carcinoma by 4-fold in women with positive HPV infection. So they recommend that regular screening are necessary to reduce the incidence and mortality from cervical cancer. This study was on prolonged use of oral contraceptive pill, a cofactor for the development of cervical cancer. It was published in Journal of Bangabandhu Sheikh Mujib Medical University in 2018. It is a retrospective cross-sectional study done at BSMMU on 100 new cases of cervical carcinoma. This study results shows that the age of marriage before 18 years was 88%, and 57% were multipara. And 31% used the oral contraceptive pill less than 5 years, and use of oral contraceptive for more than 5 years was 40%. This study shows that the use of oral contraceptive pill for more than 5 years have higher risk than non-users. Carcinoma cervix develop in those patients who use is less than 5 years than non-users. Both the squamous cell carcinoma and adenocarcinoma are associated with use of oral contraceptive pill. And the risk rises 2.5 times more in those women who are infected with HPV, use the oral contraceptive pill for more than 5 years. So from this study, it was proved that prolonged use of oral contraceptive pill may be a cofactor for development of carcinoma cervix. This article on socio-environmental cofactors associated with cervical cancer in Bangladesh, published in Scholars International Journal of Obstetrics and Gynecology in 2021. It was conducted at National Institute of Cancer Research Center on 100 cervical carcinoma patients who are attended for treatment. It was a cross-sectional study, and this study results showed that age of the 41 to 50% of the years were 52%, and they got married at between the 14 to 17 years, about 73%. 69% are illiterate, and they are 88% as housewife, and 54% come from the poor socioeconomic condition. And this study showed a surprising lack of knowledge and socio-environmental factors that play a part of it, and awareness was positively related to the education. Our next study, it is published in the Journal of Bangladesh College of Physicians and Surgeons in 2018. It is a cross-sectional study done at the Mymensingh Medical College Hospital on 71 biopsy-proven precancers and cancerous lesion. And it is done to evaluate the prevalence of high-risk human papillomavirus type 16 and 18 in high-grade cervical intraepithelial neoplasia and cervical cancer in a tertiary hospital of Bangladesh. But through this study, there are some interesting points come out that among the high-risk SPB positive patients, 96.29% come from low socioeconomic condition. And most of the patients were between the 45 to 54 years. Age at marriage was 62.5% at early age, and 56.25% were multipara. From this study, it was found a strong association between the risk factor positive high-risk HPV positive infection and cervical cancer. So in conclusion, they gave emphasis on HPV vaccination. This article on influence of demographic and reproductive factors on cervical precancer and cancer in Bangladesh, it was published in journal, Asia Pacific Journal of Cancer Prevention in 2020. It is a retrospective cross-sectional study done at the colposcopy clinic of Bangabandhu Sheikh Mujib Medical University on 16,147 VIA positive women, among 7.1% had cervical carcinoma. This study showed that among the participants, they are married before the 18 years was 74.4%, and they got first delivery by the year 20 years, about 76%. Logistic regression analysis revealed that higher age, lower level of education, low socioeconomic condition, high parity had direct influence on development of cervical carcinoma. On the other hand, age at marriage and age at first childbirth did not show any significant influence. So this study indicated that higher age, lower level of education, low socioeconomic condition, high parity as most important socio-demographic factors for developing cervical carcinoma. This study was published on PLOS 1 in 2014. It is a population-based survey conducted by the ICTRB at 2 sites, one at the urban area and one at the rural area. Though this study was done to evaluate the genital human papillomavirus infection among the women in Bangladesh, but from this population survey, very interesting point come out, that the risk factors sought out which are closely related to the HPV infection and that making the woman vulnerable. One, parity. Parity was found to be associated with HPV infection in rural women. In particular, having 3 or more children lowered the risk. Husband residency, the husbands who live overseas were the 2 times higher risk of developing infection than those whose husband lived with them. Number of lifetime sex partner of the urban woman was significantly associated with detection of the HPV infection. The women who report that 2 or more partners were almost 4 times more prone to have HPV infection. It was signified that women of urban area who work as housemaid and garments worker face more risk of sexual exploration to have the infection. In concluding remarks, it stated that the study findings will inform the formulation of HPV vaccination policies in Bangladesh and identification of the target population for screening program. This is a chart which shows all the studies or research work that I found in through making this presentation. And there is another study that is cervical cancer in low-income countries, a Bangladeshi perspective. This is a review article published in International Journal of Gynecology and Obstetrics in 2020, which also showed us that the socio-environmental factors in the study. All these studies implies that risk factors have a great association for development of the cervical cancer. Though smoking is an important risk factor, but some unknown reason, it was not highlighted in any study. Patients with immune deficiency or other sexually transmitted diseases are not included. The established risk factors also highlighted in these studies that these risk factors established that they are closely related with development of the cervical cancer. These are early marriage and first coitus before the age of 16 years, early age of first childbirth before the age of 18 years, multiparity, having more than 3 children, low socioeconomic condition that the monthly income less than 10,000, low level of education, prolonged use of that more than 5 years of taking oral contraceptive pill, and some occupation like husband living overseas, housemaid, and garment workers. But there are very limited amount of research work regarding this, and some works didn't publish it. Those published have small sample size, single institute make this less significant. So study needs to be conducted with large sample size and multiple institutes to receive data from a wide range of demographics. It will help the policymakers to develop strategies for prevention of cervical cancer. At the same time, social awareness creation about the risk factors, HPV vaccination, and screening programs should be implemented side by side. Research holding the torch of knowledge. So we have to do more research to gather the knowledge to prevent this preventable carcinoma cervix. Thank you for all for patience hearing. And thank you GOSB for giving me the opportunity to present here. Thank you once again. Assalamu alaikum.
Thank you very much, Dr. Lutfa Begum, for your very, very informative presentation. Thank you very much. So it has been written in books and it is found in the literature that carcinoma cervix is a disease of poor socioeconomic condition, is a disease of the low education society. And it has been seen that the carcinoma cervix has been controlled in the high income countries. So I'd like to request Dr. Namkha Darji to comment on this presentation. Dr. Namkha Darji. Dr. Namkha, are you here? Dr. Namkha? Yes,
Yes,
please.
madam, I am here.
Now it is your turn to comment on this presentation.
Good evening and assalamu alaikum to all my teachers back in BSMMU and all the teachers and the audiences here. First of all, I would like to thank Professor Sabera Khatun madam and the organizer for inviting me to join this first international CME on researches in Bangladesh about prevention of cervical cancer. I feel extremely privileged and honored to get this invitation, despite myself being very junior and inexperienced in this field. So to me, it is more of a learning than a panelist. Given the opportunity, I would like to make some comments. Before I make my comments, I would like to thank Dr. Lutfa, Begum, Lipi madam for your nice presentation. And you have put a lot of effort to collect so many data on this very important topic, the cervical cancer in Bangladesh. And I know it's not that I think, I'm sure this disease is equally important back in my country. And it is my responsibility after a few years to take care of those patients in Bhutan. So I feel this is an eye-opener for me as well, to study the risk factors of cervical cancer in any country. For this matter, I have gone through those studies which Madam presented just now. And what I feel is most of the risk factors that are identified through various studies are similar to those studies conducted in the rest of the world and in the published textbook. So to be a little bit different from what is there in the textbook and to generate extra or novel ideas in the scientific communities, what I was thinking when I was reading this presentation was, if there is a study that shows the factors associated with late presentation or advanced presentation of cervical cancer in Bangladesh or in Bhutan, we can also take some additional measures to prevent, besides knowing those common risk factors of cervical cancer. And in addition, as the presenter said, the number of study participants was the major limitation in all these studies. And I wish if there is a study with a bigger participant, then it would generate a better idea. And lastly, but not the least, I would like to again congratulate the organizer and thank the presenter, madam, for your nice presentation. And I would always like to be a part of Bangladesh, and BSMMU has always been in my heart, and it will always be with me. Thank you so much.
Thank you, Dr. Namkha, for your kind presence. Thank you very much. We'll call you again and again, okay?
Dr.
Thank you,
Suraya,
madam.
can I make one?
Yes, madam, you are most welcome, please.
No. From all the studies, actually, I think though the numbers were less, but I think it's a small country and still we have put in so much of effort to collect so much of data. I just was contemplating if we could have some study on HIV. Is HIV not very common in Bangladesh?
Not very common.
Not very common. Okay. So that's a
Actually,
different
it
story
has
in
not been,
India.
madam, it is not, we don't know whether it is common or not common. It has not been investigated. This test is not usually done. HIV, CSRB patient. We will start to do the HIV test in CSRB patient.
Appa, it is actually done. HIV status is done in every patient, but studies are not there because we don't have a lot of incidence of HIV. But that is a very significant point, madam, and we shall keep it under
I
consideration.
think WHO has
Okay.
a totally different screening modality for
Right.
it because cancer services is 6 times more common in HIV positive.
Yes, more
I
common in
think we
HIV
can
and
do that.
immunocompromised women.
Yes,
Thank
madam.
you, madam.
Thank you.
Thank you, madam, Bhagyalaxmi madam, for your sharing. I would like to request Professor Mozammel Hoque sir. Sir, you are very kind to hear this presentation. Would you please add something? Professor Mozammel Hoque sir.
Thank you very much. From my side,
Yes,
so
sir.
far I have listened these presentations.
Right.
Most of the studies, the only one limitation that I have seen, that is the limited sample size. But small sample size is not the major problem, because even if you do a research over a small sample size with a small population, and if you can give some idea, that
Right.
will make some focus, and depending on that focus, someone else may design better study with a larger sample size. So although most of the studies are of small sample size, but I must congratulate each and everybody behind this research, because it has opened up our eyes.
Yes.
That given some idea over the issues, and with that issue subsequently, somebody else may go on bigger research to genuinely find out the risk factors behind this devastating disease. And if you can do this, that will definitely help us in our clinical management of the cervical cancer. Thank you.
Thank you, sir, for your comment. Future studies will be done on the basis of this study, sir.
Sure.
So our second speaker is Dr. Chowdhury Samima Sultana. She will talk on HPV vaccination in Bangladesh. Researches on HPV vaccination in Bangladesh. Chowdhury Samima Sultana, please. Dr. Chowdhury Samima Sultana.
One thing,
Madam, you can say. Sabera, madam, please.
About the research done by Ashraful with a lot of people, positive people. In that research, we found that the multiparity and age of marriage is not related with cervical cancer. It is a bit questionable. I think it is questionable.
Madam, it needs more studies with large sample size. Madam, Sabera, madam, can you go for the second speaker? Sabera, madam?
Yes, you can go.
Dr. Samima, please start.
Thank you. Honorable Chairperson of and Co-Chairperson of today's CME, learned co-speakers, learned audience, and my respected teachers, Assalamu alaikum. In next few minutes, I will talk about researches on primary prevention of cervical cancer by vaccination in Bangladesh. According to Globocon 2020, cervical cancer ranks as the 4th in incidence and mortality in women worldwide, and 2nd in incidence and mortality in developing countries. And in Bangladesh, it is 2nd leading cause of female cancer and 2nd leading cause of female cancer deaths. We all know that persistent infection of cervical transformation zone with one or more type of oncogenic HPV is the necessary cause of cervical cancer. Cervical cancer is a slowly progressive disease, and its progression through precancerous changes provide opportunities for prevention, early detection, and treatment. And cervical cancer can be prevented primarily with human papillomavirus vaccine. And this vaccine developed by Professor Fraser and Dr. Jianzhou. And there are 3 types of vaccine: quadrivalent, bivalent, and nonavalent vaccine. All vaccine composed of type-specific HPV-L1 protein, which conformationally changed and self-assembled through virus-like particle by recombinant DNA technology. And humoral immunity mediated by neutralizing antibody response to L1 protein of HPV is the hallmark of protection. Different studies of home and abroad shown that HPV vaccine is safe, provide 100% efficacy, gives long-term immunity from 7 months up to more than 10 years, gives cross protection and herd immunity. And regarding vaccine schedule, in less than 15 years female, 2-dose schedule, and more than 15 years in immunocompromised female, 3-dose schedule. Now, studies done in Bangladesh, I found several types of study. Most of them are studies about knowledge, acceptance, awareness, attitude, practice towards cervical cancer, its prevention and vaccination. One study about immunogenicity and safety information of HPV vaccination, and another study about long-term immunogenicity after HPV 7 years after vaccination, and an ethical issue-related study. And now I am going through the studies. This is a study titled Knowledge, Attitude and Practice Regarding Human Papillomavirus and its Vaccination Among Young Medical Professionals and Students of Bangladesh by Shrestha Chowdhury et al. It was published in 2022 in Clinical and Experimental Vaccine Research. And the study result shows about 43% participants showed good knowledge, and only 12% showed good practice. But 76% students showed good attitude, positive attitude toward vaccination. And their conclusion was that physician and dentists play a vital role in raising public knowledge about HPV and awareness regarding HPV vaccination program. The provision of medical education on HPV must be prioritized and current training technique must be re-evaluated. Thus, by implementing this strategy, improvement in national vaccination policy can be expected. This is another study titled Awareness Knowledge about Human Papillomavirus and Attitude Towards its Vaccination Among University Students. It was a Bangladeshi pilot study done by Istiar Rahman et al. It was published in 2019 in Asian Journal of Health Science. And study results showed more than 60% students reported that they had heard of HPV, and about 40% knew that the vaccine is a preventive measure of HPV. Only 3.5% of students reported to be vaccinated against human papillomavirus. And lack of information about the vaccine, that is 53% had been reported as the main reason for not being vaccinated. And about 60% showed that their willingness to get HPV vaccine. And their conclusion was that students were aware of HPV but had a poor understanding of the modes of transmission, health problems associated with HPV and prevention of HPV. And health education program can be organized to increase knowledge and awareness about HPV infection. This is another study titled Knowledge and Acceptance of Human Papillomavirus Vaccine for Cervical Cancer Prevention Among Urban Professional Women of Bangladesh. It is a mixed method study done by Afsana Bhuya et al. It was published in 2018 in Bioresearch Open Access. And their findings was about 98% had previously heard of cervical cancer, and half of them reported to have heard of HPV as a cause of cervical cancer. Only 2% were vaccinated with at least first dose of vaccine. And in conclusion, although knowledge was low, intention for acceptance of vaccination was moderate for women and high for their guards. This study draws attention to the urgent need of educational intervention on cervical cancer and its prevention to improve uptake of available HPV vaccination in Bangladesh. It's another study titled Knowledge of Cervical Cancer and HPV Vaccine in Bangladeshi Women, a population-based cross-sectional study by Jessica Yasmin Islam et al. And it was published in 2018 in BMC Journal, and the result shows that majority reported to have heard of cervical cancer. In urban area, it is about 90%, and in rural area, 93%. And few have knowledge on risk factor and prevention of cervical cancer, and willingness to receive HPV vaccine for themselves or for their daughters was high. This is from 92% to 99%. And in conclusion, they said that detailed knowledge of HPV cervical cancer among Bangladeshi women was poor. Education on cervical cancer must include information on symptom, risk factor, prevention, etc. And despite poor knowledge, study population was willing to receive HPV vaccine. This is actually a review article titled Human Papilloma Virus Vaccine for Cervical Cancer Prevention. It was published on Journal of Bangladesh College of Physicians and Surgeons in 2021. This is a study titled Safety and Immunogenicity Profile of Human Papilloma Virus 1618 ASO4 Adjuvanted Cervical Cancer Vaccine, a randomized controlled trial in healthy adolescent girls of Bangladesh by Sabera, Khatun et al. It was published in 2012 in Japanese Journal of Clinical Oncology. It is actually a pilot study done in Bangladesh in 2008 in BSMMU. Total 67 participants enrolled. Out of them, 49 completed 3 doses of bivalent HPV vaccine and 17 were controlled. And then immunoglobulin G against HPV 16 and 18 was detected, and blood samples were collected before vaccination and 7 months after vaccination. And they found that anti-HPV positivity was 97.5%. And regarding adverse effect, pain is the major symptom, and almost 50% participant complain of pain after first dose and third dose, and 72% complain after second dose. And second most common symptom was fever, and 44% complain after first dose, 38% after second dose, and 42% participant complain pain after third dose. And their conclusion was that bivalent HPV vaccine appears to be highly immunogenic, safe, and generally well tolerated in adolescent girls of Bangladesh. Immunization of girls against oncogenic HPV before sexual debut could be a potential tool for the prevention and control of cervical cancer in Bangladesh. This is an original article. This is actually the follow-up study of previous one. It was done on 2016 by Chowdhury, Samima, Sultana et al. It was published in Bangladesh Journal of Obstetrics and Gynecology in 2019. In these studies, the vaccine were enrolled to assess the immunoglobulin G antibody against bivalent HPV vaccine 7 years after third dose of vaccination. And they found that anti-HPV 16 and 18 seropositive
Dr. Samima. Samima.
Hang up হয়ে গেছে।
To mobile, you can use your mobile. Samima.
নেটের কানেকশন কি কারেন্ট চলে গেছে মনে হয় নাকি?
টেলিফোন করো, টেলিফোন করো সাবেরা।
হ্যাঁ, টেলিফোন করতেছে। Shaima ki
Madam, she is coming. She is coming.
আসছে।
Previous slide. হ্যাঁ, এটা। শোনা যাচ্ছে না শামিমা?
আনমিউট করো শামিমা।
জি ম্যাডাম। ম্যাডাম, can you hear me?
হ্যাঁ, বলো।
This is the comparison of anti-HPV antibody seropositivity of vaccinated girls. At 7 months, it was 97%, and at 7 years, it was 93%. So in conclusion, bivalent HPV vaccine induced sustained high level of antibody against HPV 16-18 at 7 years post-vaccination among Bangladeshi adolescent girls. The durable immune response induced by the vaccine is predicted to provide long-term protection against HPV infection and subsequent development of high-grade cervical lesion and cancer. This is a WHO report from Bangladeshi demonstration study. Actually, HPV vaccine was introduced in Bangladesh through a demonstration project in Gazipur district in 2016 and 17 by the government of Bangladesh. Here, 2 doses of bivalent HPV vaccine was given 6 months apart in age range of 10 to 12 years girls. And I cannot manage the actual result, but they found that a high coverage of 94% in the first round. This is a study titled Ethical Issue Related to Human Papillomavirus Vaccination Program, an example from Bangladesh by Mariam Salwa and Tarek Abdullah Al-Munim, and it was published in 2018 in Ethics and Global Health. And their evaluation was that this program imparted inadequate knowledge about HPV and cervical cancer to the recipient and participant. There were lack of autonomous and informed consent of the girls and their parents about taking the vaccine. The program did not have any follow-up plan for the adverse effect in long run. The impact of female-only strategy in the larger social context was overlooked, and there was lack of awareness among the implementers about safeguarding the ethical issue pertaining of vaccination. And their conclusion was that adolescent health education was needed about adequate information of HPV in its mode of transmission, risk factors, and importance of primary and secondary prevention. Adolescent boys should be given HPV related health education as well. The right of making informed choice should be appreciated and respected, and more ethical discussion and debate should be done among the public health professionals of Bangladesh. This is a study, it is actually a meta-analysis titled Immunogenicity and Safety of Human Papillomavirus Vaccination in Asian Population from 6 countries. Here, the Bangladeshi study that I previously described, it was included. And
excuse me, Sabera, এটা full screen করা যায় না? তুমি ফুল স্ক্রিন করতে পারছো না, কোনো সমস্যা?
ম্যাডাম ফুল স্ক্রিন করলে এটা মুভ করছে না।
আচ্ছা ঠিক আছে, ওকে ওকে।
Thank you, madam, for joining us. Professor Firdausi, madam.
In conclusion, they found that for Asian population, HPV vaccine enhanced the level of HPV 16 and 18 specific antibody for both uninfected and infected individuals. The risk of adverse events related to vaccination are acceptable. More data are needed to establish vaccine efficacy with regard to prevention of HPV infection and further outcome, including cervical intraepithelial neoplasia and cervical cancer. So we need future research. And our recommendation, large population-based studies is essential to assess immunogenicity of HPV vaccine over time in Bangladesh. Efficacy study of the vaccine need to be conducted. Studies are necessary to find out the percentage of low responder, predictor of low response and need for booster dose. Health education on cervical cancer and its prevention should be organized, and national HPV vaccination program should be implemented in Bangladesh. Thank you very much for patience hearing.
Thank you very much, Dr. Samima Sultana, for your very informative presentation. In our country, a very successful immunization program has reduced the infant mortality rate, and we, the Gynae Onco Society, need a very committed HPV vaccination program to reduce the cervical cancer. HPV vaccination does not only reduce the cervical cancer, it also reduces the HPV-related benign diseases. It will reduce the benign vulval intraepithelial neoplasia, cervical intraepithelial neoplasia, and also invasive cervical cancer. So I'd like to request Professor Bhagyalaxmi Nayak, Madam, to comment on this presentation. Professor Bhagyalaxmi Nayak, Madam.
Thank you so much. At the outset, I thank Sabera Madam, Dr. Suraya, and of course, Ferdowsi Madam for finding out time from our busy schedule to be here. Thank you, Madam, and it's a pleasure to have you on board. So I think it's fantastic work from all of you there in Bangladesh for having so many studies, and thank you, Doctor, for compiling all of them together and so nicely. And the last study, I think the meta-analysis was really icing on the cake. So I think it's an eye-opener for all of us that we need a little more things. So all I can add here is that HPV vaccine, I think we had a lot of studies which have shown that there is little awareness about HPV vaccine. So I think it needs a tremendous effort from all of us and take many other stakeholders on board so that we make HPV vaccine as popular like the COVID vaccine, so that people start asking for the vaccine. We don't need to go and ask them, do you need the vaccine? Take the vaccine, this will protect you from cervical cancer. I think that much, because we have all the digital platforms and all those things. So my request to all of us that we can think about something by which people start asking for COVID vaccine. There are lines for COVID vaccine. So I think we need to take HPV vaccine to that level, because as all of you know, WHO has marked 2030 to 90, 70 and 90, so that we need to work for elimination of cervical cancer. But in low resource settings like ours, I think it looks like a far cry. But then I think I have to inform all of you that Serum Institute of India has now started preparing indigenous vaccines. So I think we will get it at a very, very low cost now. So I think the cost barrier is going to go. That's one thing. And MSD has produced a very nice public awareness video, which I have already shared with Professor Sabera Madam. I think she will share it with you. And I think in case it's possible to change to Bangla, or we can tell the MSD people to make it in Bangla. I think that's a very nice video, so that it's very appealing. I think that is one thing. And the most important thing, I think I have to break that news here, is about the single dose vaccine, which is coming up in a big way. And I think in 6 months time, the WHO guidelines are going to change, because India was an important stakeholder, because in 2010, due to some reasons, huge vaccine trial was halted. So we had girls, 3 cohorts of girls which had 1 dose, 2 dose and 3 doses. So that was a natural study which we got from that. And it has a study of antibodies in these girls has shown that a single dose is as immunogenic as 2 doses. So, and there are other centers which are also doing similar studies. And the CHAIRPERSON has indirectly, non-officially also declared that a single dose vaccine before 20 years of age is enough. And I think we'll be saving a lot of money in that. And about the study which Sabera Madam's continuation study, which has shown that 7 years down the line also the immunogenicity is still as high as it was. But the only thing is that if you could extend this study and see how many of them are not developing CIN. So I think some studies can continue from this study. And I think as of now, there is no role of booster, because we can understand. And adding to Suraya Madam's what she has told about HPV vaccine, it protects against vaginal cancer, vulval cancer, and nasopharyngeal cancers. So I think that's a lot of added advantage of taking these vaccines. And number 2 is that I know WHO allows taking this HPV vaccine up to 45 years of age. But I think as clinicians, we all of us know that the immunogenic potential is very good when it is given at a younger age. And the biggest disadvantage with this vaccine is that when we are counseling our patients, we can't really tell them that it's 100% protection. So they have to continue screening. That's the biggest thing, which when they are investing 3,000 rupees for 3 doses and then they again have to continue screening, that is when actually it is a big setback. So I think if we have a single dose and tell them to continue screening and give them at a younger age, But having told everything about HPV vaccine, we still have to remember that there is a group of cervical cancer which is not associated with HPV. Maybe the numbers are small, but they do exist, and we have to be careful about those groups. So I think thank you very much for giving me this opportunity. I learned a lot, but then my many congratulations to all of you that in spite of Bangladesh being a small country, all of you are so dedicated and bringing out so many papers on HPV awareness, vaccination and everything. And many congratulations, and my salam alaikum to all of you, Firdausi madam, especially Mozammel sir, and all of you there, Dr. Fawzia. Thank you so much.
Thank you, madam, for your very nice, excellent presentation. We are always happy with you. Professor Mozammel Hoque, would you like to add?
Thank you very much. I don't have that much knowledge about the vaccination, but
You
from
just tell about the methodology. and others.
epidemiological point of view, I should say that first of all, you people, particularly all gynecologists, including other researchers, should define whether this HPV virus is necessary and sufficient cause of cervical cancer, or it is necessary but not sufficient cause, or it is sufficient but not necessary cause. As Dr. Bhagyalaxmi told, that some people without having HPV virus might develop the cervical cancer. So we should develop some documentation that if you like to popularize this vaccine, how much protection we will get. So if this figure is encouraging, then definitely we should go for the mass awareness through the stakeholders so that this vaccine gets popularized as our other vaccines as well as COVID vaccine. So we people, as a researcher, as a professional, I think should address these particular things. If we like to develop this vaccine, or if you like to popularize this vaccine, if you like to add it in our management schedule, then how much protection we shall get? What will be the public health benefit? In that line, we should go for further research in future so that this vaccination program may get successful. Thank you.
So no vaccine is 100% protective, and almost 95% cervical cancers are by HPV virus, and there is gap in everywhere. Sir, would you like to describe what is necessary factor and sufficient factor for us in this forum? We would like to hear you from in very simple way, sir. What is necessary factor and what is sufficient factor? Yes, sir.
Necessary and sufficient means that if you get this sort of picture, that if somebody gets cervical cancer, she must have HPV virus. Without having contact with the HPV virus, nobody will get the cervical cancer. If this is the fact, then it is necessary and sufficient.
This is a fact.
In that case, it is possible to eradicate, to control totally by vaccination. Otherwise, it is not possible. So I like to add that particular thing, that we should measure out this particular aspect. So if you get the vaccine, then how much protection we shall get from epidemiological point of view? That is important.
But it is
sufficient, sir? Sufficient factor?
Professor Firdausi Begum would like to say something.
Okay, madam. Firdausi madam, please.
Yeah, thank you for giving me this floor. To the chairperson, the committed people for elimination of cervical cancer, and the researchers today. I think this is a great opportunity that we have learned many of the researches which has been coming out. Yeah, can I have a break? আমি একটু পরে কথা বলছি, হ্যাঁ শ্রেয়া, please continue করো, আমি আরেকটা মিটিং
Yes, madam. Yes.
আচ্ছা, আমি একটু বলতে চাচ্ছি,
Yes, madam.
say something about the necessary factor and sufficient factor. These two are very important. But Professor Mozammel Hoque raised. Usually, it is said that the HPV infection is a necessary factor for the development of cervical cancer. It is necessary,
but not sufficient.
And
That is the thing.
that is the thing. It is a necessary factor. HPV is a necessary factor for development of cervical cancer. If a woman has some risk factor, say the early marriage, early childbirth, multiple sexual activity, she will not develop cervical cancer until or unless she is infected by HPV. That is, HPV is a necessary factor for cervical cancer.
Now, madam, most of the HPV infections are cured, disappears automatically, spontaneously. It doesn't mean the HPV infection 100% will develop cervical cancer. It is a necessary factor. Other factors will contribute for development of the cervical cancer. I think Mozammel sir will clear it.
No, this is okay. This is okay. Suppose I like to give an example. Suppose factor A causes some disease, or factor B causes some disease, or factor C causes some disease. All three factors individually can cause the disease. So these are sufficient, but not necessary. Factor A can cause the disease. It is not necessary, but factor A itself can cause the disease. But other than factor A, factor B can also cause the disease. So in that case, it is sufficient, but not necessary cause of the disease. But in case of cervical cancer, I think HPV virus is a necessary cause.
Necessary. Yes, it
necessary
is a necessary factor.
But without this HPV virus, somebody can have cervical infection. In that case, if you focus over only the vaccine, in that case, our will not get that much sufficient success. That is my point to address. So we need to determine the contribution of the HPV virus in cervical cancer. In a very sparse, plain language, I like to determine out what is the percentage of cervical cancer patients in our community without having exposure to HPV virus. So if you get the majority people has got the HPV virus, then definitely vaccine is most important.
I think the answer is, Bhagyalaxmi, please, you are an expert. Please go ahead.
Hello, I'm Professor Sabera. The problem is that we have 100 types of HPV. That is the biggest challenge for us. So I think if we do the test first in cervical cancer patient for all the oncogenic types, then only we can tell that it's negative or positive. And sir, I have one query also for you. Sir, if so many people are having HPV infection, why some people are able to throw away the infection and some people are not? So I think that should be an important area of research, so that we know this woman is not going to throw away the infection, so that we do focus more on the women which we think are going for persistent infection. I think persistent infection is more important as a carcinogenicity. Yes, sir.
Right.
Thank you, sir. Thank you very much.
So can I comment now?
Yes, sir. Professor Madam, please.
Thank you so much. Regarding Professor Mozammel's concern, I think this is a complex issue because the viruses are there. There are some certain risk factors, and the screening test, the diagnostic test, everything has many questions, and especially these strains. So many strains to bivalent, quadrivalent, nanovalent. So it increases the coverage. But at the same time, it is being said that recent data we are seeing that even a single dose vaccination with bivalent vaccine is working quite at high level. I think that's just common, but I have some talks about, I want to mention 4 things in very short period. Number 1 is, I'll request Dr. Bhagyalaxmi to share the video with me, please. So also with me, so that we can talk and see, we'll learn from you and maybe develop something from Bangladesh. Number 1. Number 2, I'll request Dr. Bhagyalaxmi, because I have asked you so many things from you, and recently I need to talk to you and work with you for something. So please do contact me. I have sent you some messages as well. Number 3 is the local vaccination. I do not know if anything has mentioned it. Bangladesh, one of the pharmaceutical companies in Bangladesh has come up with the vaccine. I think this is a good news. So, and I think all the OGSB members had got a text that we are having a clinical meeting, launching of this program on 2nd of August in person. So please do respond. Please do respond this mail because we have limited seats. So we want you to be there. But at the same time, we mentioned that we check the quality as well, quality control. What is the quality control process they are going through? I think I can share that with Dr. Bhagyalaxmi that how much quality control has been achieved. And as far as they say that they have good quality control, both national and international, as per WHO guideline. So hopefully Bangladesh is having this, and the cost will be around 2,500 and 2,500 taka. But that is a bit expensive for our general people, but it will basically cover the gap in the market. There is no vaccine presently in the market available. So I think that's a great hope for us, and especially the one dose, the single dose, which is coming up, that will be really something will be hoping good for us. Simultaneously, the government was working hard for the last time, and we are trying to push them. Hopefully, from the next year 2023, our girls aged from 9 to 14 will be vaccinated. So that's the government plan so far. And from the year onwards, after maybe 24, they are going to vaccinate only 9 years old girls. So I think that will be a good coverage. The government are planning to. So hopefully that will work. It's a huge job. And so many things has to be done before that. Orienting all OGSB members, all pediatricians, because we need pediatricians are there to support, serve this group of women as well, the parents, the students themselves. We need to develop a positive culture, and we need to learn from the countries and the professional groups who are working on that. So we are hopeful. And Bhagyalaxmi, please, I'll be with you for some time. I really need your help, Bangladesh group of people, for cervical cancer. So we'll work together. Thank you so much.
Thank you very much, Professor Ferdowsi, Madam, for your speech and joining with us. Thank you very much, Madam. High-income countries has been reduced the number of cervical cancer by screening. Whatever is our socioeconomic condition, whatever is our vaccination, cervical cancer prevention needs screening. So now Professor Fawzia Hossain will present screening of cervical cancer. Professor Fawzia Hossain, please.
Thank you, Brigadier Surayam Apal. Good evening and assalamu alaikum, ladies and gentlemen of this August gathering. First of all, I would like to thank Professor Sabera Khatun for inviting me to speak on this auspicious program. Actually, I'm unable to move it if it is full screen. So I think I'll just continue.
Okay.
So I'm currently working in Department of Gynecological Oncology, Bangladesh Medical University as unit head, and recently I have been elected as Vice President of BDSSP, and I also work as International Affairs Secretary of OGSB. So I bring warm greetings from Bangladesh Medical University, where all of you are linked. It is our parent organization. I would like to declare there is no conflict of interest in my presentation. We all know that cervical cancer is preventable and curable, and it constitutes about 12% of all female cancers. It is the 4th most common cancer worldwide and 2nd most common in Bangladesh. More than 50 million Bangladeshi women are at risk of developing cervical cancer. There has been 8,068 new cases and 5,214 deaths in Bangladesh in the year 2018, and around 5,69,000 new cases and 3,11,000 deaths worldwide, according to 2018. To eliminate cervical cancer, we have to maintain an incidence rate of below 4 per 100,000 women. Research on cervical cancer screening by Pap test and colposcopy has been prevalent in Bangladesh since the 1990s, but via pilot project was started in Bangladesh in the year 2005. We have around 500 VIA clinics, and these are established at primary, secondary, and tertiary level healthcare facilities of the 64 districts of Bangladesh, and it is provided free of cost to all women between the age group of 30 to 60 years. From January 2005 to December 2021, around 350,000 VIA tests were performed, and 3.86% were found to be VIA positive, and the population coverage was 15.93%. So this is the performance of VIA in Bangladesh from January 2005 to December 2021. We all know that visual inspection of cervix with acetic acid is a simple process which constitutes swabbing the cervix with 5% acetic acid solution, and the precancerous cell structures are temporarily turned white, and these can be easily identified by trained doctors, nurses, and paramedics. It is a relatively simple and low-cost approach and requires minimum infrastructure. The results are available immediately, and we all know that the treatment of precancer is quite simple. These are glimpses of women seeking VIS service during the COVID-19 pandemic. So Bangladesh launched the cervical cancer screening program in 2005 as a pilot and scaled up to all 64 districts by 2010. In 2019, total women screened were 387,000 and 4.1% of them tested positive. They were referred to any of the 38 colposcopy centers, and the colposcopy clinic at the Bangabandhu Sheikh Mujib Medical University in Dhaka is receiving a quarter of all referrals. These are the backgrounds of cervical cancer screening in Bangladesh. These are the existing colposcopy clinics, and proposal for future colposcopy clinics are in Pabna, Cox's Bazar, Kushtia, Gajipur, Jamalpur, etc. I have found 40 research papers regarding VIA, which has been done in Bangladesh, and it shows a distinct evolution of the VIA program. First of all, the pilot project in 2005 was commenced, and scaling up in all 64 districts occurred in 2010. The see and treat approach was established in 2012, the population-based screening in 2018, and during the COVID-19 pandemic, the electronic data monitoring through the community clinics were done in the DHIS2 system. Some of the glimpses from the works of VIA, the mic announcement, the field group discussion, registration, group counseling in some of the districts of Bangladesh. Now you might think that why I'm saying all these basic things. In order to make it very easy, I'm just recapitulating a few things. What is research? Research is a powerful and methodical search for new knowledge and practical solutions in the form of answers to questions. And again, serendipity is the phenomenon of finding something unexpected and useful while we are looking for something completely different. So there are two main types of research studies, observational and experimental. And a scientific paper is a written and published report describing the original research results. A scientific experiment is not complete until the results have been published and understood. The types of research studies are basically the analytic studies where they examine the etiology and causal associations, maybe experimental studies and observational studies. Amongst the 40 research papers, only 2 were among the non-randomized controlled trials, where the subjects are allocated to an intervention of control group, but without randomization method. And the majority, the 38 papers, were observational studies, that is, observations made without any interventions. For example, there were cohort studies, case control studies, and cross-sectional studies. And the purpose of the scientific writing is basic, to communicate the scientific findings. Thus, it has to be clear, simple, and well-ordered communication to transmit new scientific findings. A good research paper is a one that easily conveys our ideas to the readers. We need scientific writing because knowledge is lost without written records, and knowledge could not be widely circulated without any effective duplication. So I used a Medline-based literature search was performed for articles relating to screening for cervical cancer by VIA method, and additional original papers cited in those identified by the initial search were also reviewed. So amongst the 40 papers, I will highlight few of the papers, but just reading some of the titles like role of print and audiovisual media in cervical cancer, testing and reporting the results of VIA, women's knowledge, attitude, and practice on cervical cancer, direct visual inspection with acetic acid, a cost-effective test. Then lack of knowledge is the leading key for the growing cervical cancer incidence in Bangladesh, screen and treat approach to cervical cancer prevention, contextual effect of community health center on VIA, nurses' knowledge about VIA tests for screening of cervical cancer, etc. The first scientific paper I found was published in 2008 on the Reproductive Health Matters, an international journal on sexual and reproductive health rights. The topic was development of a visual inspection program for cervical cancer prevention in Bangladesh. So here, the program, they commented that the program now needs to move from opportunistic screening to population-based systematic screening of women over the age of 30. More providers need to be trained and clinics better equipped. The links between screening, diagnosis, and treatment need to be improved, and the false positive rate of VIA tests will be greatly reduced. The next one was evaluation of the National Cervical Cancer Screening Program of Bangladesh and the formulation of quality assurance guidelines by Parthabasu Ashraf-Nessa. And this was the first evaluation report of a VIA-based National Cervical Screening Program, and it was published in 2010 in the Journal of Family Planning and Reproductive Healthcare. So I have, I'm showing the research papers on chronological order. Next one was International Journal of Gynecology and Obstetrics, and it was also published in 2010. It was a clinical article. Title was Screening for Cervical Neoplasia in Bangladesh Using Visual Inspection with Acetic Acid. Another one in 2011 published by Elsevier Limited was the Best Practice and Research, Clinical Obstetrics and Gynecology. The need for simple, cost-effective screening approaches for cervical cancer prevention in low-resource countries has led to the evaluation of VIA with 3 to 5% of acetic acid. Despite all its limitations, implementing VIA screening in low-resource countries may provide a pragmatic approach to building up human resources and infrastructure that may facilitate the highly anticipated low-cost rapid human papilloma virus testing in the near future. The next one was published in the Annals of Oncology in 2011, Clinical Trials of Cancer Screening in the Developing World and Their Impact on Cancer Healthcare by R. Sankar Narayan and also Ashraf-Nessa. The large evidence-based, the IARC, International Agency of Research in Cancer, collaborative studies have evolved into major focal points of training and extending services in many countries. The large evidence base resulting from their study was to facilitate much wider scaling up of screening and treatment services through organized programs. The next one was an interesting study published in 2012 on Open Journal of Obstetrics and Gynecology. Title was Development of a Cervical Cancer Screening Program in a Slum Setting Using Visual Inspection with Acetic Acid, Analysis of Feasibility and Cost. In this pilot study, A.K. Khan Healthcare Trust, in collaboration with oncologists at Massachusetts General Hospital, launched a biocervical cancer screening program. A clinic was established in the Coral slum of Dhaka, and 10 women living in the Coral slum were recruited and completed a 3-month training program to learn how to do a pelvic examination and to evaluate the cervix using VIA. 3 of the 10 women performed bioscreening during the study period. 44 patients were recruited and 8 women were identified to have VIA-positive results. And one of the women had undergone treatment for cervical intraepithelial neoplasia. Another one had early invasive cervical cancer and was successfully treated in a local hospital. So the conclusion was that the pilot project demonstrated some important factors in developing and implementing a successful screening program. Involving lay women as healthcare workers provides a strong tie to community, as well as education, economic independence, and empowerment for women who would otherwise occupy a lower social standing in their community. VIA is feasible in the complicated environment of an inner city slum. It was feasible to perform minor excision procedures to treat pre-invasive cervical disease in the slum clinic. Next one was a research article on comparison between VIA and cytology-based screening procedures in Bangladesh. It was published in 2013 in the Asian Pacific Journal of Cancer Prevention. Next one on screening for and management of high-grade CIN in Bangladesh. A cross-sectional study comparing two protocols was published in the Journal of Obstetrics and Gynecology Research in 2030 again. And here, the aim was to evaluate the feasibility of the CN treat protocol for the management of high-grade CIN at a colposcopy clinic in Bangladesh. They concluded that CN treat protocol is a well-accepted, feasible, and useful option for management of high-grade CIN in Bangladesh. It reduces the number of visits to the clinic and failure to receive treatment. Another original study, which is a crossover randomized trial, not a description or analytic study or cross-sectional hospital-based study. Topic was evaluation of stationary colposcope and the gynocular by the SWIT score systematic colposcopic system on VIA positive women. And it was also published in the International Journal of Gynecological Cancer in 2014. Another research article, the role of HPV DNA tests in follow-up of treated CIN in Bangladesh. Next one was another original article published in the Journal of Enam Medical College in 2014, role of VIA in detecting precancerous lesions of cervix. This was a cross-sectional study, and they concluded that VIA and colposcopy are the important methods in the evaluation of cervical pre-malignancy. VIA may be an important tool for screening of cervical cancer in low-resource settings, as it is easy to perform, and we can screen cervical cancer by VIA all over the country and thus reduce morbidity and mortality rate. Another, efficacy, safety, and acceptability of thermocoagulation to treat CIN. Another interesting study published in the Global Oncology was on population-based cancer screening programs in low-income and middle-income countries, regional consultation of the International Cancer Screening Network in India. In this series of paper, they outlined 6 essential elements for population-based cancer screening programs that policymakers might want to consider before implementation. I'm just going to say what the steps were. The first step was area to be covered by the screening activity, age group, recruitment method, screening method, and the screening provider, financing, screening interval, method for follow-up, payment of follow-up or treatment, data files, performance indicators, time interval for publication of performance indicators, quality indicators, process indicators, access to treatment, trained human resources, and facility infrastructure for screening. The second essential component was continuum of care. The third essential component is the development of a strong infrastructure for screening implementation. The fourth component comprised of minimum data elements, performance and quality standards, contextual understanding of patient population, data oversight standards. The fifth essential component was planning for community engagement, awareness about cancer, and the possibility of early detection remained low in the low and middle income countries. And the last essential component was to consider the implementation of science and research. The next review article in 2018, published in Bangladesh Journal of Obstetrics and Gynecology, was on cervical cancer screening program in Bangladesh. It was a descriptive type of study, and it concluded that Bangladesh has established VIA as screening test for prevention of cervical cancer in a good number of facilities with wide coverage, but the program has to be expanded readily to prevent cancer and reduce sufferings and untimely death of women due to this devastating disease. Another study in 2019 on prevalence and management of CIN by colposcopy among VIH positive cases in a tertiary level hospital of Bangladesh was published in International Journal of Medical Research Professionals. And it was a population-based study conducted in Cervical Medical College Hospital. Next one, also a research article named Influence of Demographic and Reproductive Factors on Cervical Precancer and Cancer in Bangladesh. This was published in 2020 in the Asian Pacific Journal of Cancer Prevention. The next one was published in PLOS Global Public Health. And in January 2022, it was a cross-sectional survey and conducted to collect data via a structured questionnaire from Sheikh Hasina Medical College of Tangal District in Bangladesh. And they found that among all the interviews conducted, only 45.2% had heard of cervical cancer as a disease. The study revealed that evidence of significant association between marital status, literacy rate, residence, and socioeconomic status with women's knowledge on cervical cancer was prevalent, and it was higher among women with university-level education. Women's knowledge, attitude, and practice on cervical cancer and its screening in Dhaka, Bangladesh was published in Asian Pacific Journal of Cancer Prevention in 2021. And it concluded that women were knowledgeable about cervical cancer and likely to have a VIH test. However, the VIH test is underutilized and HPV vaccine coverage was low. Another one, the last one here, I'm going to highlight on this, was published in the Preventive Medicine in October 2021, and the topic was leveraging vertical COVID-19 investments to improve monitoring of cancer screening program, a case study from Bangladesh. Again, Partha Basu and Ashafunnessa, madam, they were the authors. It highlighted that COVID-19 pandemic has significantly affected cancer screening programs globally, and it has also created new opportunities. Most of the limited resource countries have strengthened the health information system, and they have used it to monitor COVID-19, and this can be upgraded for cancer screening as well. So by doing so, Bangladesh reported the COVID impact on cervical cancer screening. I'm going to highlight it, few of the points, because I found it very interesting and something very new to be taken care of. So it is about the customization of which IS2 to collect cancer screening data into the Bangladesh experience. As you all know, the government of Bangladesh launched an initiative in 2010 to transition from paper-based system to the DHIS2 platform to collect and utilize routine health data from more than 13,000 community health clinics. By 2019, Bangladesh became the largest DHIS2 deployer in the world. And a dedicated DHIS2 module was developed to manage data from the National Cervical Cancer Screening Program. A training of trainers program was introduced to train a large number of data managers on a continued basis. The system is being utilized to collect and aggregate the cancer screening performance data, that is the number of women screened, number of women screened outside the target age, screen positivity, treatment rate on monthly basis from health facilities since 2013. So Bangladesh launched a pilot project in each division of the country in 2018 to switch from opportunistic to population-based cancer screening program. As a part of the initiative, the DHIS system was upgraded to collect the individual data. The NID issued to every citizen by the national government is used as the unique identifier. The data collected by the community workers is transferred to the online system from the paper forms at the community clinics. And information system has enabled the community clinics to track the women from non-compliant to becoming regular screeners. This is the latest information published on 13 January 2022. Here it shows the structural referral system with online patient appointment. So you see here in the community clinic, there are referrals will be done by smartphone or laptop or desktop. And this will go to the Union Sub-Center Family Welfare Center. From there, it is going to the Upazila head complexes. Now, all data will be synced with a cloud server and will be linked with DHIS2, HRIS, shared health record. So from there, they will be referred to the district hospital, to the medical college hospital, and immediate notification to referred centers and automatic appointment is being done from the district hospital to the medical colleges. Sometimes it may be they can forward the referral, downward the referral, and in some exceptional cases, they may be referred to the specialized hospitals. And in both ways, from here to here and from the specialized hospital to the community clinic, the seamless communication through the app is being done. So I thought that this was something very new, which I found during my search on the papers. So as you all know, the pandemic was an impetus for the government to expand the information system to the most distant primary care facilities. And COVID-19 pandemic induced a significant decrease in the number of screening tests, but a short disruption in cervical cancer screening should not lead to increase of cervical cancer incidence. The screening program is aimed at detecting precancerous lesions, and access to treatment is guaranteed, as in the case of the screen and treat approach implemented in Bangladesh. So the take-home message is, the summary of my presentation, that around 40 scientific research publications were available from Medline and Google Search. Majority of them were descriptive type of analytical studies, which were 13 in number. Cross-sectional hospital-based studies were 14 in number. Prospective interventional study were 6. Crossover randomized trial 1, hospital-based comparative study 2, retrospective cross-sectional study 1, population-based cross-sectional study 2, cross-sectional survey 1. Most were original articles, 2 were review articles. From January 2005 to December 2021, around 3,665 VIA tests were performed. Amongst them, 3.86% were found to be VIA positive, and the population coverage was 15.93%. Now, we have to cover the population for the target group of the women to be screened up to 70% by 2030 if we have to reach the target given by WHO. Now, whether VIA can reach the WHO target to eliminate cervical cancer is an important point to ponder. So more studies on HPV DNA method, which WHO has recommended, versus VIA should be performed. And lastly, I must mention Professor Ashrafun-Nessa for her praiseworthy, unique dedication. So first of all, I would like to thank Professor Ashrafun-Nessa Madam, because amongst the 40 papers I searched, more than 90% were your contributions. And you are unique in your dedication in the field of preventive oncology in Bangladesh, and you are a torchlight for us and for your colleagues and your students. So we are indebted to you for this continued research, publication, and effortless work. So I want to thank Professor Ashrafun-Nessa for her determination and dedication. And I would like to thank the learned audience, the organizers for your patience hearing. So thank you very much. That was all from my presentation. Thank you.
Thank you very much, Professor Fawzia Hossain, for your very exceptional presentations. Your presentations are always exceptional.
Not at all, Appa.
Though carcinoma cervix is a disease of Southeast Asia, it is a disease of Africa. The WHO has recommended HPV DNA test as a screening test for all over the world. But in the context of Bangladesh, we have to continue with VIA. It will take time for implementation of the HPV DNA test for screening. Anyhow, I would like to request Professor Mozammel Hoque sir to comment on this presentation, and I would like to request him to give a very simple definition. What is research? Who is Professor Mozammel Hoque sir? He is very experienced in research methodology, and he is a very expert in biomedical statistics. Sir, Professor Mozammel Hoque sir.
Thank you very much. But before jumping to my actual academic business, I like to extend my heartfelt gratitude to Professor Sabera and Brigadier General Suraya for giving me this opportunity to talk in this platform right now. And this platform has given me the opportunity to make connection with another very big academician from India, Bhagyalaxmi, and another from Bhutan, Namkha Darji. So I am glad, I am delighted having this opportunity to talk with you. I again like to extend my respect to my teacher Kuhinurappa. I don't know whether he is still in connected or not with that, and my Professor Ferdowsi. Anyway, in within one sentence, if I like to comment about this presentation, it's an excellent presentation, full of information, lots of information that has been done in our country over the cervical cancer regarding the Bhaya. Regarding Ashraful Nessa, she is my friend, medical college classmate from Dhaka Medical College. I also feel proud of her, because she has advanced this research over the cervical cancer and Bhaya. Now, if I like to answer your first question, what is research in a simplified manner, I have learned this concept, a simplified concept of research from a writer on research methodology, probably from Indian writer. I forget the name right now. Research is a problem-solving activity. It's a very simple thing. Problem-solving activity in an ethical manner, in a scientific manner. This is actually research. So to do a research, you have to be in a problem first. And you have to identify a particular problem in your professional life, in your social life, as well as in your other aspect, even in clinical life. If you identify the problem and if you can solve this problem in a scientific way, in an ethical way, that is actually the research. Same thing goes with the cervical cancer. It's a problem because nobody wants cervical cancer. Nobody wants to suffer from cervical cancer. So it's a problem. And the idea of the problem is the expectation minus reality. My expectation is no cervical cancer I like to see in my community. But the reality is a lot of cervical cancers are getting to see in our community. So there is a gap between expectation and my reality. So it's a problem. So if I pick up this problem, cervical cancer of our community, I can do research about this problem to solve this problem. Solve means I like to eradicate the cervical cancer from my society. I like to carve down the incidence of cervical cancer in my society. That is my actual research activity. So any type of disease, if we like to eradicate, if we like to control, two things is important. If it is particularly associated with the biological agent, particularly virus or bacteria, two things important. One is vaccination, another is the secondary prevention, that is screening test. Vaccination goes with the primary prevention and screening test goes with the secondary prevention. Both is important, simultaneously important. Now, this Bhaya actually deals with the business of the secondary prevention, that is screening test. So to deal with any sort of disease or problem, first of all, as a public health expert, we should know the magnitude of the problem. We should know the magnitude of the cervical cancer in our society. We should know the distribution of the cervical cancer in our society. Who are the people affected mostly? Who are the most vulnerable peoples of the cervical cancer? And finally, we should know the determinants of the problem, the determinants of the cervical cancer. That is risk factors of cervical cancer. So all three things must be in front of us. That is magnitude of the problem, distribution of the problem, and determinants of the problem. In each and every aspect, we can do lots of research to conceptualize or make out the magnitude, to make out the distribution, and to make out the risk factors or determinants of the disease. So in this risk survey, that is screening program, the Bhaya is a recommended test for cervical cancer. Apart from Bhaya, of course, there is HPV DNA test, but the screening test deserves some qualities, some characteristics. A screening test must be widely available. A screening test must be cheap, low cost, and a screening test must have more acceptability to the people's, general common people's. And it must be of low tech, not high tech. And finally, most important thing for the screening test is that it must have very, very high promising sensitivity. Now, I don't know what is the sensitivity of the Bayer test. Of course, the international community has recommended this Bayer test as a screening. Definitely, they are happy with the sensitivity pattern of the Bayer test. So from academic point of view, if I say that if you like to use the Bayer for screening of the cervical cancer in our community, this Bayer in our community, our people must have very high promising sensitivity. So of course, this Bayer about this, I don't know how much research has been done over the sensitivity of the Bayer itself in comparison to the histopathology or cytopathology like this. So if you get the very high promising sensitivity of the Bayer, then it is okay. So again, I like to say, this Bayer is already in practice in our community, and lots of research work has already been done from BSMMU, Bangabandhu Sheikh Mujib Medical University, under the leadership of the Professor Ashraful Nessa, and all these publications we have got. But it's a big effort, it's a big contribution, I must say. It's a big contribution, but yet more long way we need to go. Because if you like to really carve down the cervical cancer, then we must make the wider screening test over the total country, over the total population, targeted population. But I think the process that has been initiated by Professor Ashraful Nessa and in her team, they have already done lots of work. But my request is you continue this project and you try to bring total, all vulnerable group of women under screening program. If we can bring it, then I think we will be able to reach the goal that is set down by the WHO to eradicate the cervical cancer. So along with vaccination, this screening program must be continued. And by screening, you will identify some cases. But we should remember that screening test positive doesn't mean that they have got the disease. So there might have some subsequent test. A very high sensitive test, the quality of this very high sensitive test is they don't miss a person with disease. That is the advantage of the high sensitivity that is needed for the screening test. A high sensitivity never miss a particular individual with disease, but there might have some false positive as well. So to eradicate this false positive, we have to depend on the subsequent test like colposcopy or something else. So you go for screening test, you go for vaccination, hopefully we will be able to cut down, will control or contain the problem of cervical cancer in our country. So with Bhaya, we have advanced a long way, but my request is, I think this team will go further, and in near future in our country, we hope that almost all women vulnerable to cervical cancer will be able to brought them under screening program, and we'll be able to identify the cases and we'll be able to treat the cases. And in that case, hopefully, we will be able to get rid of this burden of cervical cancer of our society. So I like to again congratulate and extend my thanks to Professor Ashraful Nessa and her colleagues who are taking the leadership over the steering to cut down this program of cervical cancer. Thank you very much. Thank you all.
Thank you very, very much, sir, for your nice and excellent speech. We will call you again and again in our program, sir. Thank you, sir. Bhagyalaxmi Madam, do you want to add? Bhagyalaxmi Madam.
Sir has explained very well about research. So I think, and we really congratulate Ashraful Madam for her dedication into the subject. So I think, as Sir has told very emphatically that VIA has been has stood the test of time for cervical cancer screening. But I think WHO and the whole world is now moving from VIA to HPV, which is a more specific test. But at the same time, I think I have to tell that till we have the HPV test, we have to continue with VIA and make it more widespread. And the second thing is, I think we are all responsible persons here, and we know that what use we have made of all our machines during the corona pandemic, when we have established many machines to test RT-PCR for this corona testing. I think all those machines can be again be used for this HPV testing. So I think that should be kept in mind, and I think the policy makers should be made aware that the same machines can be used for HPV testing. And so India is also having a shift over from the Government of India guidelines of VIA testing to HPV in the near future, and many meetings are going on. I think we can do that. So I think Bangladesh is such an organized country. I think the digital health system is really excellent. I think, and taking help of that is good. And so I think you can very easily, because you have a screening program in place, so very easily you can shift from VIA to HPV. I think because you will have those machines in place. So thank you again, Dr. Fawzia, and all of you for the excellent collection of the research work all of you have done together. Thank you so much.
Thank you, madam. We are grateful to
Ashwapandisa,
you.
madam, do you want to comment, please?
Ashwapandisa, madam.
Ashwapandisa is there.
Professor Sabera Appa, because she has arranged this nice program, and all the speakers have spoken so nicely, and particularly Fawzia, really she had to do a very hard job. She collected so much literature, and many of them actually I did not know about 8 or 9 literature she has mentioned, but there is also more literature from Khulna Medical College Hospital, Rajshahi Medical College Hospital, and it's actually not my work really. It's whole country is working, all the OBGYN are working, all societies are working, because we have program in 500 centers, so everybody is working, my colleagues are working, and the colposcopists in different medical college hospitals, they are working together, and particularly the government is really taking active role. That's why we can work. So I'm really very much grateful to all of them, and actually many of them are trying to initiate research, particularly research on HPV, but it's so much expensive that they cannot take much sample even. And so that is very important. We need to actually WHO should take some step to reduce the price, to initiate more studies and research, particularly for the young generation. And I'm very much grateful to Bhagyalaxmi also. She is really staying with us all the time. And Professor Mozammel, my students are always after him to take help from him, and he's really doing a very great job encouraging research to many researchers of our country. So I'm very much grateful to all the audience as well for the support. Thank you all.
Thank you, madam. Your spirit and inspiration is working in whole Bangladesh, whole Gynae Society, whole OBGYN specialist, all sister, and all other paramedics also, madam. Thank you very, very much, madam. Now, I would like to request Professor Sabera Khatun, madam, to say something. Sabera Khatun, madam.
Madam, please unmute yourself.
Thank you, Dr. Suraya, for asking me to tell something. First of all, I would like to thank Professor Mozammel Hoque. He attended this webinar first. He was the first person to attend this webinar. And he has spent about more than 2 hours, 2.5 hours in this webinar. So first of all, I thank him for participating in this webinar and giving us the very important, I have got very important information about the research from Professor Mozammel Hoque. And I think this webinar, by this webinar, our students will be benefited, especially those students who are working for thesis, and some very small things should be understand before going for a thesis. And that's why I have selected this topic about the researches done in about the risk factors, about the vaccination and the screening. First of all, VIA is a most simple test. So I have first selected VIA as a screening test. And step by step, I'll go for the HPV test, researches on HPV test done in Bangladesh, researches on cytology done in Bangladesh, and the results of these researches. Next time, I will request all the speakers about the results of research. We have got very few information about the researches on risk factors, vaccination, and VIA. So next time, we should emphasize on the results of researches done on the risk factor, on other factors on cervical cancer. Next time, I think it will be better to find out the results of research. This is my suggestion for the next webinars, which will be done next time about cervical cancer. And I'd like to give thanks to Dr. Bhagyalaxmi Nayak from India. She's always with us. She's always with us. Never she tell, I'll not be able to attend the webinar. She is always with us. So I'm very much grateful to her. And Professor Begum Madam, and she is also always with us. I must give my thanks to my heart to Professor Begum Madam. She is our inspiration. I should tell that she is our inspiration, and she is always with us. Thank you, Madam. And other speakers, all the speakers have told very nicely about that, and I think they have to do very hard work. The speakers have done a very hard work to find out the research is done in Bangladesh and the results of researches. They have done very hard work, I must say. Especially Professor Fawzia Hossain have done a very hard work, because a lot of researches has been done about VIA in Bangladesh. I think you will find more research on VIA. There are many other researches on VIA. It is since 2005, the VIA is done in Bangladesh. So, and panelists, other panelists, that is Dr. Namkha Darji also, he is very interested to attend the various programs in Bangladesh. I am very grateful to him. Thank all, and especially Suraya, Dr. Suraya Begum. She is my most reliable and most responsible coordinator. She always hammering me.
Right.
She always hammers me to do these things. Thank you, Dr. Suraya, for doing this great job. Thanks.
Thank you,
very
Madam.
much.
Suraya, I think Jonaki and Afzalun Appa has raised hands. Would you ask them to comment?
Afzalun এসে কিছু বলতে চায়?
And Jonaki also raised her.
Please unmute them.
জান্নাতুল ফেরদৌস।
Dr.
জোনাকি
Jannat-
অনেক আগে হাত তুলে আছে।
Yes, Madam. Madam, first of all, I like to give salam to all my teachers. And today's webinar is very successful and extraordinary, as my teacher, Professor Mozammel Hoque, is among us. And actually, I want to say something, giving attention to Mozammel Hoque. Yes, sir, some very rare types of cervical cancer are not caused by HPV. And literature shows that about 5 to 10% of all cervical cancer are HPV negative cervical cancer. As you have mentioned that, is it necessary or is it sufficient? And that HPV negative cancer actually may be truly negative or it may be false negative. Truly negative cancer actually adenocarcinoma variety, and false negative HPV false negative may be due to histological misclassification or latent HPV infection or non-high risk HPV infection, or HPV testing method may be faulty. So these are actually in response to my SARS query, and I like to give thanks to all the presenters for their informative, excellent presentation, and many important issues are being discussed. But one thing is that other than the HPV, other risk factor and contributing factor like malnutrition, folic acid deficiency, barriers to cervical cancer screening, these are not highlighted. And I myself did a study on the level of folic acid in patients with cervical cancer, and it was statistically low. So there are also many issues to research, and this webinar is very much excellent. This is eye-opening, and I like to give thanks to Sabera Khatun Madam to select such a topic that is helpful for both the faculties and for the students as well. Thank you all.
Thank you.
Hello.
Thank you.
I
just want to add one thing that also Professor Mozammel mentioned about the sensitivity in our, in bio-related programs in our country. It is around 60 to 70% that we have calculated several times. It is published also in two articles.
In one of the papers, yes.
Though it is quite less than HPV, and anyway, we have to ultimately we have to go for HPV test definitely after some time whenever we can afford it. Thank you.
And 60 to 70% sensitivity higher. So I think it's not a good test for screening.
No,
it's not a good
but
test
it's
for screening.
cheap and accessible and affordable. That's why.
So
For
we should keep it in
So we
mind.
should have something. So I think for the time being, VIA is good enough till we have something better.
For the time being, it is good
For the
enough.
time
We
being.
have
Yes,
the
of
activity.
Just for the time being. Yes.
We have to do both simultaneously.
Taking many cancer and high grade.
Can I ask
You
one thing?
remember 60% sensitivity means 40% false negativity. So 40% false negativity is very unusual.
Risky to the patient.
But risky. But according to the Bhagyalaxmi, it's okay. Even then, we have been able to identify the 60% patient. That is good enough. So in future, we should move for better tests with higher sensitivity.
We are trying. We are
So
trying.
that is why actually we are having some artificial intelligence aided gadgets now coming up, which will augment the vision of VIA. So
Right. In that case, it is okay.
So that will
So WHO shifted to HPV test.
Surayappa,
Yeah,
will you request Afzal
Tell them to unmute Dr. Professor Abdul. They will unmute.
Yes. Assalamu alaikum to all.
Yes.
My video is not working, so I only call. So thank you for the Professor Sabera Madam for arranging the nice CME program for the prevention of cervical cancer. And thank you, panelists from home and abroad. Research is very important in the prevention of cervical cancer, and vaccination and the screening both are important simultaneously, side by side. Vaccination is not enough for the prevention of cervical cancer, and the screening has additional. So we should ensure about the availability of the vaccine, and Bhagyalaxmi Madam says the single dose vaccine is sufficient. So more research work is needed for the vaccine is very important, and availability of the vaccine is important in our country. And screening already says the Bhaya is popular in our country, and Professor Fawzia says a lot about the Bhaya, but gradually we try to shift according to the WHO, if possible.
Unmute karo. Afzal.
situation, in existing situation, we need more research on the knowledge, attitude, awareness. It is very important. We know that actually awareness in school health, in different garments factory, in different location, and also population-based screening is very important. So more research, it is possible, and more economic for the research about the knowledge, attitude, and awareness in different media. Also, if possible, single dose vaccination. And finally, I think monitoring and evaluation is also important. Some people say and think that, yes, already vaccinated, complicated, so no, there is no need of screening. And some say, I do screening and that get treatment of CIN by CN treat or in any method, either thermocoagulation or lead. But follow-up is very important, and more research on the biomarker, that is the molecular study. I think everybody know, if possible, this molecular study or biomarker study research is very important. That is indicate the progression of disease from the CIN to invasive cancer after the treatment and during the follow-up. I think in different level research is very important. So every
Thank you, Appa. Thank you so much, Afzal Appa. I think Professor Kohinoor Madam will say something.
Thank you, Madam. Thank you, Mozammel sir. Thank you, Bhagyalaxmi Madam, and thank you, Professor Ashapurnesa Madam, and thank you, Professor Firdausi Madam and Sabera Madam, for giving me chance to say something. Thank you, Dr. Suraya.
Thank you, Madam. Thank you. Professor Samina Chowdhury, Madam, would you like to add? Madam?
Actually, I think this is a very good program. Today we have observed about the research on what research has been done in our country. And I found that we have done a good work. And Dr. Lutfa, she has a good paper. And one important issue came out that the HPV prevalence is 7.7% in one study. And that is one important findings. And about Dr. Chowdhury, Samima, she has mentioned about the vaccination program in Bangladesh. And one important issue is that the cervical cancer prevention by HPV vaccination program, it was started in 2008, and which was led by Professor Fazlul Karim, sir. And we had a group of people, and I see there were Professor Shahla Khatun, Professor Sabera Khatun, Professor Fawzia, Professor Kohinoor Begum, and me, and also Jannatul Firdaus and others. We have started this vaccination program in Bangladesh. And initially, we have to make some programs in school and college and university for this campaign of vaccination. And ultimately, it was a successful program. And this study, Dr. Chowdhury already shown to us. Thank you very much for that. About Fawzia, about VIA program, I think it's quite a successful program. And for that, I must congratulate Professor Ashrafunnisa and her team. One important strength of this VIA project is that it also created a awareness among the healthcare provider at the grassroots level and also our women. That is, I think, that another important issue of this VIA program, that we have at least created a group of women. They know that what is VIA. So I think this is a program on research, and Professor Mozammel Hoque, and he delivered a very valuable speech. And I also want to thank Bhagyalaxmi, and she was throughout the program, she was with us, and she has given many opinion to us and her comments and recommendations. Thank you. And Dr. Namkha Darji, he was also with us, and he also sent some valuable comments. And I must congratulate all of you and Professor Sabera and team and GOSB. Thank you very much for this program.
Thank you, madam, for joining us. May I request Professor Kohinoor Begum, madam, for your final speech, madam. You have been with us for a long time.
Madam, please unmute yourself. Kohinoor madam. Kohinoor madam, please unmute yourself.
Unmute
Now we can hear you.
A very good webinar. We have learned a lot, and I didn't know that so much research has been done in Bangladesh on different subjects, and the outcome was so good. So it is a very, very good sign. And we hope in near future we'll have much more research on more research on this cancer service, ovarian cancer, endometrial cancer. Let us hope for the best. Thank you very much.
Thank you, madam. Please stay with Gynae Onco Society of Bangladesh always. We always need you. Thank you, madam. Sabera madam, is THOG sir here? THOG sir has joined.
সামুন ভাইয়ার আসবেন না, তুমি ভোট অফ থ্যাঙ্কস দিয়ে শেষ করে দাও। আপা কি বলেন আপা?
তাই তো, স্যার তো আসতে পারবে না, অনেক রাত হয়ে গেছে, এখন প্রায় 10:30 বাজে, স্যার আসবে না। তোমরা থ্যাঙ্কস দিয়ে দাও, থ্যাঙ্কস দিয়ে শেষ করে দাও, অনেক রাত হয়ে গেছে।
Madam, Professor Kohinoor madam, for your chair. I would like to thank all three speakers for their fantastic presentations. I am very grateful to 3 panelists from home abroad who has enlightened our program. And last of all, I would like to thank Renata for their great contribution. With their help, without their help, this program would not have been possible. Thank you, madam. We'll see you again. Thank you.
Thank you very much. Thank you all.
Thank you, madam. Thank you, sir. Assalamu alaikum.
Professor Fawzia, fantastic presentation.